Okay, so without further ado, we will begin. Welcome everyone. I am Dr. Iqbal. I am a clinical professor of psychiatry at the University of Pikeville. I'm also a psychiatrist here at Baptist Health Hardin in Elizabethtown. It's very nice to see everyone. Let me know if there's any issues with the microphone, if it's too loud or not loud enough. Just raise your hand. Pretty informal here. If you have questions, raise your hand at any time. There is going to be time later on at the end of the lecture or presentation for questions, so keep that in mind as well. But if it's pressing, ask away. So today what we're going to talk about is signs of dementia, diagnosis, and prevention. Some very interesting developments have occurred this year regarding prevention of dementia, and we will be talking about that at length today. So this is an outline of the presentation today. Can you see the slides okay? Up there? Good. You see the outline? Very good. So we'll talk about what dementia is. We'll talk about the signs and symptoms next, diagnosis, and how to get it diagnosed, prevention, which we will spend a good amount of time on as well. We'll talk a little bit about treatment briefly, and then we will open up the floor for questions. So the first question is, what is dementia? Dementia is a general term for a group of brain disorders that cause memory problems and make it hard to think. Now, it's a general term. It refers to a constellation of symptoms, a pattern of symptoms. It's not in itself a disease. There are many different diseases that can get to it, that can lead to that pattern. And that's going to become a little more evident, hopefully, later on as I keep talking about this. There are general symptoms of dementia, but there are very specific paths, different paths to getting there. And those different paths lead to more specific symptoms. What you see in dementia is a significant decline in cognitive functioning, so much so that it's hard to function at home and at work. Like I said before, it's an acquired syndrome with multiple possible causes. There isn't a specific cause because it isn't actually a disease itself, but a pattern of symptoms that is arrived at through other different diseases. The risk factors are age, genetics, vascular disease. Interestingly, advancing age may not be as big of a risk as we previously imagined. And again, this is something that I'm going to get into later in the presentation when we start talking about prevention, because there have been some exciting new developments in what we're discovering about dementia. There are several types, as I've kind of already mentioned. There are reversible types: B12 deficiency, folate deficiency, abnormal thyroid levels can all lead to what looks like dementia, but if they're treated, that constellation of symptoms reverses. But then there are also irreversible types, like Alzheimer's. Interestingly, there are different diseases that lead to dementia, and they can present in combination at the same time. So you could have, can you hear me okay? Okay, so you can have Alzheimer's plus vascular dementia. Vascular dementia is something that is, it's a way to get to the symptoms of dementia through having multiple strokes. But you could have them both occurring at the same time. In fact, frequently when someone has dementia, it's because of a combination of etiologies. I'm going to move this a little bit out here as far as the cords permit. I'm not a very good driver. Yeah, so you can see me now? Okay. It's very important that you can see me. I'm teasing. So the global prevalence of dementia is about 7% in those over 65 years of age. That's globally. However, in developed countries like ours, because we live longer, the prevalence is a little bit higher because we have longer lives, more years to develop the dementia. So it's more like 8 to 10% here in the US. Now that's kind of an overview of the definition of dementia and a little information about it. Now let's go into the signs and symptoms of dementia. So there are general symptoms that apply to all types, and then there are specific symptoms that apply to each particular disease, disease under the heading of dementia.
Good morning. My name is Bree. I'm with Encompass Rehab Hospital. I'm just going to take just a short time for the therapists come up and go over what they're going to be talking about, just to kind of explain a little bit about what Encompass Rehab is. We have been in the community for 37 years. We are Encompass now, but the majority of our time was as Health South Rehab Hospital. And if you've been here for a very long time, you'll remember us as Lakeview. So as on the 10 years, I'm sure I saw some heads nodding, so they've been here for a while. So we are an acute rehab hospital. Kind of what that means is we run as a hospital does. Our doctor will see you every day. You will have an in-house pharmacy that will explain all of your medications to you at discharge. And you'll have therapists that will see you every single day while you're with us, all in the setting of a hospital, but their actual focus is going to be that rehab to get you home. And this is going to be after you've had a hospitalization for any diagnosis. You could have been in the hospital for pneumonia, you could have been in for a hip fracture, a stroke, anything on those lines that's brought you to the hospital and now you are not at the level you were before you went in. This is a resource that is available to you here in the community. We do not have long-term beds or long-term patients, so we are strictly geared for that rehab and then back to home again. Typically, right now, year to date, we've had 82% of our patients that have been discharged back home between 7 and 14 days is our average. So in that time that you're with us, you'll be able to get about 15 hours of therapy over a 7-day span. According to how much you can handle at one time is going to be how those hours are broken up. But an average is 3 hours a day that you would be receiving with us if you ever needed our resources. If you haven't ever heard of Encompass before, that probably means that you haven't needed rehab, which is a good thing if you haven't. But we are readily available here for you all if need be. We have a full-time respiratory therapist as well. So if something happens to bring you or a family or a loved one to the hospital and now they're on new oxygen or new breathing treatments, you are able to have a respiratory therapist that's going to help get your lungs stronger, give you those exercises, and start getting weaned off of those as needed during your whole stay with us. And they'll be all working one-on-one with the therapist as well, so that the therapist is going to know what's going on, where are you getting short of breath, where are you weak. They're going to communicate that to the respiratory therapist. The doctor's going to round on you every single day. If you have any specialty doctors you see, along with podiatry, nephrology, pulmonology, a lot of those doctors also have rights to see you as well in the hospital with us. So you'll have your regular doctor you'll see every single day. And on top of that, If you do have another physician that you see and you've seen them in the hospital and you see them out in their office, they have that right to also come and still check on you too while you're getting rehab with us. We are certified with a Joint Commission for Pulmonary, which is going to be like a COPD, and for stroke rehab. And we also have support groups that are readily available for everybody in the community, and also some in the outlying territories. We have 2 caregiver support groups that we do in Adair County and Taylor County. The Taylor County is the 3rd Tuesday of every month, and the Adair County is the 2nd Tuesday of every month. And these are for caregivers for any reason of diagnosis or just a good support system for resources out in the area and community. There is a Parkinson support group that's going to be starting in November at Encompass. And it's going to be November the 7th, and then the next one would be December the 5th. Is there time? At 4 p.m. We also have a stroke support group that we are partnered with Baptist Hardin with. It's on the 2nd Tuesday of every month at the Swelt Building, and that's for caregivers or the patient who's had their stroke themselves are more than welcome to come. The food is free. It is great resources for any questions or concerns. If you even have a friend that you know who's had a stroke in the past, it is open. They have fall prevention specialists come in and go over education. Pharmacists come in and speak to everybody. Same line with the caregiver support groups in the outlying territories. And the Parkinson support group will have that same pretty much agenda of having people come in, helping with resources, helping with being able to keep everybody safe and keep everybody at home and keep everyone healthy.
My name is Prentice Alford. I work with the Care Guide Partners, better known as PACE. We're here at the Golden Years today, just sharing some of our information with some of the locals, just to see if we can get somebody to come in to actually join our program. Yes, the PACE organization, it is a great organization for anybody to come out and join. You gotta be 55 years or older. Even if you don't want to join, just come down just so you can see the facility.
My name is Sarah Hickman, and I am here with Feeding America, Kentucky's Heartland. And as a community resource specialist, I'm here to learn and make partnerships with other resources in the counties that we serve with our food pantries, and also to let them know about the food programs that we have for seniors, for children in the back program for schools, and just general food assistance if somebody needs some extra help now and again, because the price of food is crazy expensive and we all need some help sometimes. Don't be afraid to reach out to ask questions and learn resources in your area, because finding out where to go is sometimes the hardest part of it. And it can be overwhelming, and we strive to work with other partners to help get the information out there.
Yeah, my name is Ben Humphreys from Kentucky Estate Planning Law Center. Focus on estate planning and elder law here in Elizabethtown. I've been practicing law for over 20 years. Today I'm going to be presenting to the Golden Years crowd about medical powers of attorney, financial powers of attorney, living wills, just talking about, making sure you have those, who you want to appoint, what are the characteristics of the kind of people that you want to appoint, and then when they do start acting, what kind of standard of care, what kind of standard of their actions are you looking for? In other words, what duties do they owe to you? And basically, you want them to make sure that they make all their decisions in your best interest. And so that's kind of what we're going to talk about today. I think they also wanted me to mention a little bit about how to avoid scams. That would be the fake Facebook marriages and romances, the fake calls that you might get saying that somebody's going to do something to your family, or a fake check that you get in the mail that people say is real. And, it's the old rule that if it sounds too good to be true, or if it sounds too terrible to be true, it's probably not true. And so just kind of being aware of those things. And so that's what we're going to talk about, and looking forward to a great event.
My name is Jessica Marin. I am with Kentucky Community Action Council. I am here today representing our retired senior volunteer program and our senior companion program. And we're offering opportunities for our seniors to get out of the house and keep active and with our community. We are absolutely looking for volunteers. We're always looking, so please contact us. Our website is HCEC.org, and you're welcome to go there and find out more information about our program. And we'd love to have you as part of our program.
My name is Valerie Moore. I'm the Director of Clinical Outreach for the Department of OBGYN at the University of Kentucky.
And why are you here today?
Tammy and I are here today promoting our ovarian cancer awareness program. It's a research program through the Marquis Cancer Center, and we do free ovarian cancer screenings on women over the age of 50 or women over the age of 25 who have a family history of a GYN cancer.
And is there anything that you'd like to share with the community?
We are providing screenings at the Hardin County Health Department, and we're there once a week. If anyone's interested in being in our screening program, you can call 1-800-766-8279.
I'm Officer John Thomas with the Elizabethtown Police Department. We're out here participating today in the conference to help educate our senior citizens about the many scams and different types of identity theft and fraud that are frankly prevalent all throughout our nation. In 2023, senior citizens suffered over $3 billion in losses in the United States due to fraud types of crimes. And from our perspective, an ounce of prevention is worth a pound of cure, so we try to do our best to warn senior citizens about the different types of scams that are out there, whether it's internet, mail-based, or even in-person types of fraud. And our goal is to keep our senior citizens informed and safe. From a community standpoint, we encourage people to follow us on social media. We're on Facebook and Instagram. We do our best to alert citizens about scams and other types of crimes in our area. Again, our goal is crime prevention. We would rather prevent crime than have to deal with it after it's happened.
Hi, my name is Tony Williams. I am the Nutrition Education Assistant here at the Hardin County Extension Office, where we do healthy cooking, making healthy choices, and also working out in the community doing classes with the recovery groups, with the school students, and at the seniors sites as well. So if there's anything that you need from us here at the Hardin County Extension Office, feel free to call at 270-765-4121. Thank you, and my extension is 118.
My name is Mike Anders, and this is my wife, Debbie. We're both volunteers with the Alzheimer's Association. We're here today to provide awareness about the kinds of programs that Alzheimer's Association have, educational programs, handing out some literature that people may find useful, and also remind them that you can get any kind of information you want for free from the Alzheimer's Association website at alz.org. There's also a toll-free number, which we have on refrigerator magnets. It's 800-272-3900, and if you call that 24/7, if you're concerned about a loved one or you just have general questions about the Alzheimer's disease, they'll provide this information for free.
Yes, had to figure out the laptop. So I thought I would start with a few graphs from the CDC. This particular graph shows the use of prescription drugs in the past 30 days. And we can assume that that means in a recent 30-day period, because it wasn't a graph that was made in August, I can tell you that. Now the graph shows a comparison of the United States in blue and Canada in green, and we're really just focused on the blue in this one. Those left two bars represent the number of people who took one or more prescription drugs. That first column is for adults aged 40 to 59, and the second column for adults aged 60 to 79. Okay.
Can I ask a quick question? So raise your hand if you take one prescription medication every day. Raise your hand if you take more than 5 prescription meds every day. Raise your hand if you take more than 10 prescription medications every day. Do you take meds more than one time a day? Do you take meds in the morning, lunch, and evening? Sometimes twice a day. Sometimes they all run together, right? Yep.
Okay, and that second two columns, the two columns on the right, really represent that number of 5 or more prescription drugs at the same time. So really this is just a visually busy way of saying that about 83% of adults age 60 to 79-year-old take more than one, and about 35% of that same group take 5 or more medications at the same time. So let me ask you this now, what do you think are the most common prescription drug types? Blood pressure? Cholesterol? Ooh, sorry? Thyroid, diabetes, heart and vascular. Any others? Oh, anxiety. That's a good one too. And our next slide really shows the last graph. I didn't want to graph you to death on this one. But these are the most common prescription drug types among adults. And I went ahead and added that red box around 60 to 79-year-olds so I could break it up. And you can see that cholesterol, those lipid-lowering drugs for cholesterol, are the most commonly prescribed medications in the United States, accounting for about 59% according to this graph. And the graph also shows the most common prescription drug types among, okay, so I just repeated myself, I'm sorry about that. Both age groups have similar conditions, but the percentages are different for the two groups. And you had mentioned all of them. High cholesterol, high blood pressure, and diabetes are shared by both groups. And it looks like for the 40 to 59-year-old group, their top 5 is rounded off with pain and depression, while the 60 to 79-year-old group rounds off their top 5 with indigestion. And I didn't hear that one mentioned. So now let me ask you this. How many of you know someone who has more than one of these conditions?
All right, so we're going to make sure we understand the importance of nominating people, doing those powers of attorney, make sure we understand the roles, and then just making sure that you're building a team around you to have somebody in place. Go to the next slide. All right, I've already did. Keep going. Yeah. All right, so has anybody here ever been appointed as a power of attorney? Yeah. Yeah. Did anybody here say, I would never be that again? Anybody ever had that experience? Yeah. I've been a power of attorney for 3 people, and by the 3rd time I said, I ain't never doing that again. That's a lot of work. Isn't it a lot of work? Yeah. It is a lot of work, okay? When people come in and mom or dad's really sick, their life, the fiduciary, the person that's been appointed, their life is really tough. You may think mom or dad's life is really tough because they're going through a lot of stuff. I'm telling you, there's a lot of weight that's put on the shoulders of the people taking care of these people. A lot of weight, okay? And the hardest thing to do as a fiduciary is to be able to separate your emotion from what you need to do for mom or dad, or for your husband, or for your kid, all right, or even for your grandkid, or just your neighbor, okay? We're helping out a couple right now. The gentleman next door, their neighbor, did not have anybody that could help him. He didn't have any family. His wife had died. His kids don't live around here. No, and he didn't have anybody to help. So the neighbor is having to step into this fiduciary role, trying to separate emotion from duty, and trying to make the right decisions. And the hardest thing is that they have jobs, right? They got to go up and get to work 8 to 5, and then come home and take care of mom or dad or the neighbor. And that's a lot of work. You know, they're having to do accounting. They're having to pay somebody else's bills, mow somebody else's yard, find nursing homes, get people in nursing homes, apply for disability, apply for VA, all this stuff. It's a lot of work. It's a lot of work. No kidding, okay? And so it's important that if you appoint somebody as a power of attorney, or that you make it clear. You can pay yourself. All right, make it clear to your kid. It's okay for you to be compensated. Let's talk about that. I'd like to compensate you because it's a lot of work, okay? And a lot of people think, well, I'll get mine on the back end. Right? I'll figure all this out later. Well, it never happens, right? Mom or dad's health just keeps getting worse. You never get around to that conversation. That mom or dad's pretty soon, mom or dad are not, they're too far gone to have that conversation anymore. And so now, what are you just setting your own salary? And then your brothers or sisters won't agree with that salary. What do you do, right? So have the conversation early. You're entitled to some money, and make it reasonable, right? And so it depends on what you're doing, okay? And so, but anyways, being a fiduciary is a lot of work, okay? Go to the next slide. All right, so this is the healthcare proxy. okay? The healthcare proxy, in our common language, is the medical power of attorney, okay? That's what a healthcare proxy is. It's the medical power of attorney, all right? And this is the legal document that authorizes someone to make your healthcare decisions for you in the event that you're unable to do so. And there's some federal law about all that. And so they're going to be making healthcare decisions, all right? So here's the question. When does this medical power of attorney kick into effect? When do you all think? So you've signed the document, you've got it offline, you went to a lawyer's office. When does it go into effect?
They can't make the decisions themselves.
Yeah. When you can't make decisions, what'd you say?
2 doctors.
2 doctors, maybe. Maybe your power of attorney has that language in it. Anybody else? So when I first started practicing law, 20 years ago, I can't believe it's been over 20 years. 20 years ago, it was very common for a medical power of attorney or a living will or a financial power of attorney to say that the document would not spring into effect until something like 2 doctors have signed off saying you're not able to do things anymore, okay? We've got some doctors in the office in here. Who thinks that a doctor wants to come in and hang out with the family and say, yeah, I think we should sign this document right here, and what do you think? Is that something you all really want to get into every single day, all day long? No, they do not, okay? And so what was happening is all these powers of attorney had this triggering or springing clause in it that was requiring doctors to sign off on it, and the doctors didn't want to do it. I mean, they haven't met with you in that capacity. I mean, that's a legal conclusion. And what if they're wrong, right? There's been some exposure to them, and so that's not really something they were wanting to jump into. And so, in the last, I would say, 10 to 15 years, springing powers of attorney have pretty much gone away, right? So when you sign a power of attorney document, a medical power of attorney or living will or whatever, it's effective right away, right? When the ink dries, it's there, okay? And you might say, holy moly. You mean these people can make my decisions for me and I don't have any power? What did I tell you all at the beginning? You all have the power of appointment. And that only goes away, right, when you no longer are competent or you pass away. So, when you do a medical power of attorney, you still have the power to make your own decisions. You haven't given that away. Does that make sense? So all you've done is said that somebody else can make those decisions as well, if you're not able to, right? So if I'm not able to make decisions, then somebody else can make those decisions for me. And they have to make the decisions that are in my best interest, right? That are going along with my wishes, all those things, okay? And so what do you all think will happen if you're at the doctor's office and you say, I don't want to get that surgery, and your power of attorney is sitting there saying, yep, Mom, Dad, I think you're going to do that surgery. Who wins? What do y'all think? Yeah, the patient wins, right? Until you're declared legally incompetent to where you can't make decisions anymore, you win, okay? I had somebody call recently and they said, so-and-so's locked me away and they won't let me leave this facility. And I said, well, have you been through guardianship court? And they said, no. And I said, well, you can just leave then. You can just go. You know, you're the boss until a judge says you're not the boss, or you go up to heaven, right? One or the other. It's got to happen before you can't make these decisions on your own. So, you know, and of course the family was like, well, thanks a lot, man. You know, I was like, well, all of us have rights, right? We all have rights. We have the right to vote, to bear arms. We have the right to sign contracts, to the power of appointment. We have these rights. You can't take away my rights to make medical decisions just by me giving you the power to help me out sometimes, okay? Does that make everybody clear? All right, so just signing a medical power of attorney doesn't take away your rights, okay? All right, that's very, very important.